Hi, my name is Kaitlin Goodbrake, and I am just one person that has been affected by addiction in some way, shape, or form. And addiction has surrounded my whole life with people that I love. And this is a heavier topic, but I really want to discuss, this huge war that's going on and the fact that a lot of people just aren't getting the help that they need because they're not getting the resources available to them. And I'm going to discuss why health insurances and drug addictions are two huge things that should be considered, especially when it comes to health insurance coverage. Addiction is a continuous war. It's one of the longest and hardest fought wars in any society across the globe. But in America, it's a huge plague, as I would like to call it. According to the American Society of Addiction Medicine, their article Definition of Addiction, addiction is a treatable chronic medical disease based around the brain circuits and genetics, the environments, and individuals' life experiences. This is proven to be a scientific disease. It is not a choice, and anybody that tells you otherwise, I personally believe that they should reconsider and think of the scientific standards that have been discussed for people with addictions, specifically drug addictions. Bustamont's substance abuse and addiction statistics in 2020 uses 2018 and 2019 results to kind of give you an idea as to how relevant this addiction, these numbers have increased. There have been 60.2% of Americans, about 165 million people, that have suffered some type of an addiction, not necessarily drugs, but drugs are a part of that. As you can see, 20.3 million of those 165 million people over the age of 12 reported some kind of substance abuse disorder, meaning that a doctor had given them, the circumstances to say, this is your disorder because of your substance abuse. In 2019, urine samples testing positive for potentially fatal drugs increased drastically from 2018. So it's not getting any better. And why is that? Well, if health insurance has provided the coverage necessary for people to obtain the right treatments and counselings, seeking treatment would be so much easier. People would be able to say, I'm ready, and get the help that they need. There would be a wide variety of resources available to those who have the supplemental coverage. And society would obtain positive benefits like less crime rates, less deaths, and more people working and getting back into society. And with that, drug addiction and counseling and treatments should be covered by health insurances because of those points. And I would like to bring up that I recently just lost someone super close to me within the last 2 months due to a drug addiction. So this is really important to me, and I hope that you can keep an open mind when I go through these statistics, and hope that maybe you could help me in my fight for health insurances to provide that coverage. The ease of seeking treatment would be better. These statistics right here came from the Addiction Center's article of cost of drug and alcohol rehab. These are huge numbers to try to pay out of pocket. This is one of the hardest things to do. Most people can't even afford a car, a house, let alone try to get to treat something that is almost one of the hardest things to treat. And that's why these values right here just kind of let these sink in and just showcase why this is super hard for somebody to try to pay out of pocket for a disease, So government has laws in place for the coverage. However, insurance companies have found loops in that. Meaning that when they go to write their policies, they leave out certain diagnoses in their policies, so people can't get the coverage. And that's not fair. That's not fair to anybody. Roberts Gray brings to the light that a health plan can include certain diagnoses, even if they are deemed to be in the realm of physical, mental, or behavioral mental health, meaning that there is no necessarily a rule against them going against some of these diagnoses, but it just goes to show how silly some of them can be. Now, the availability of resources would open up. Detox, inpatient, outpatient rehabs, and medications would be available, those same numbers that we discussed before. If you wanted to read more on a lot of the questions that are asked, visit the American Addiction Center's rehab insurance, health insurance coverage for alcohol and drug treatment. Because this is that article really breaks down some of the major questions that come with, how can somebody get the help and what is available to them. Societal benefits. Like I said, people would give back to the community if they weren't fighting their problems. They would be willing to go back to work. They would be willing to give back to people, to those who are suffering the same thing as them. Crime rates will decrease. According to Sawyer in 2017, in his article for the BSJ report, Drug Abuse and Addiction at the Root of 21% of Crimes, states that state prisons and local jails are incarcerated due to drug affiliation. 21% of those crimes that are being committed are related to drugs. But the most important thing is that less lives would be lost. Going back to Bustamante's article, 700,000 people since 2000 have lost their lives to some kind of substance abuse. And I'm unfortunately one of those people that has to live with that, within that statistic. So, positive benefits would come from people being able to have the help necessary. This war is going to wage on. But all in all, if health insurances just provided that coverage, provided that help, they would be able to make finding treatment easier and way more accessible for people who can outreach to it. It would open up many possibilities for connections to other resources, and it would help people give back to society in so many more positive ways than negative ways than what we are experiencing right now. But like I said, this war is going to wage on, and the help of others who have the power to contribute can save lives and families from living the horrors that addiction will bring. And with that, I can't really stipulate enough that yes, the speech is on a time limit, but I truly, truly believe that if more people cared and more people fought, then those bigger powers would listen, and those bigger powers would be willing to give in and help those who are in need of help and that need that treatment. And instead of finding loopholes and try to find ways to save money, I truly believe that money is nothing compared to the lives that are out there today. And with that, I appreciate everyone that was willing to listen to this, and thank you for your time.